Good afternoon. My name is Rose Atibuni. I am a member of National Community of Women Living with HIV and AIDS, and I'm very privileged to speak on behalf of the people living with HIV on this auspicious occasion of commemorating World AIDS Day 2025 in Arua City. The beauty of this occasion today is that the three important functions have been amalgamated all to take place today in this same venue at the same time by the same people, and that is the commemoration of elimination of gender-based violence against women and girls, and also the International Day of People with Disabilities. So, and I like that because you see many times people don't come for these occasions, but when you bring three categories together, at least the turn-up is fair. So I think that is an advantage or an achievement by the organizers. So what I want to say about the situation of HIV, the prevalence of the city, I think if I have not forgotten, is like 3.3%, and that is, it has gone up. It was around 2014 it was 2.3 even, but now that 3.3 is an upward trend, and that's unfortunate. And unfortunately, it's among the young people. So there's need to make strategies to help control that direction that it is taking. And the theme for World AIDS Day today is overcoming disruption and transforming the AIDS response. And I think, in my own understanding, that theme has been generated because, by and large, over the many years, the AIDS response has been supported very much by external funding. So we are now to overcome the disruption that has resulted from the sudden cut of funding from especially United States of America. So we have to overcome that disruption. And for us, the people living with HIV, we were so scared, we were even threatened. The service delivery format was changed from HIV clinic services to OPD services. That means all of our privacy was taken away. We were left to face the stigma and discrimination in the OPD. And for many of us, that is very challenging because, especially young people, they still need their privacy. The old folk like me who have been in the street talking about our HIV status, it is okay. But for the young people who still have their personal plans of marriage and what, it was very disappointing, and some of them even openly said they would not come for services. So I think this theme is very good in that it is telling us to transform the approaches that we are going to use, to adopt to new ways, and maybe more cost-effective ways as opposed to the ones that we have been used to. So to the people living with AIDS, my point is that let's embrace this new change and adopt to the new approach which the government has designed. But government should come out more clearly about the counseling component that is very important and yet neglected. When we were tested positive those years, I tested positive in 1991, and immediately I was exposed to quality counseling. And so it's not from nowhere that I can now talk about my HIV status and do advocacy. It's because I was empowered through the counseling I got. So my advice, my contribution is that let the service providers do something about reinstating the counseling services to especially people who have been diagnosed newly to be able to accept their situation and cope, so that their contribution towards eliminating HIV as a public health threat by 2030 can become a reality. This government has done a lot in the fight against HIV and AIDS, especially in the earlier years of the 80s and 90s. However, of late, I think there has been a relapse in the political will also. So I think if the political will can re-energize their participation in pushing this fight forward, so that the world is that strategy of eliminating HIV as a public health threat by 2030 is a target set by World Health Organization. But we have individual and local issues that need to be addressed, not only at city level but at the government level, at the political level. So my view is that that area needs more revamp, and there should be an element of human rights approach. Human rights approach definitely will lean very much on one-on-one counseling with the people. It may not be for all the people living with us, but there are people who really need that personal touch of a counseling service. And all that needs more money. The government should not run away from budgeting more for the interventions towards reducing the spread and improving quality of care for those who are already infected. HIV and AIDS, I think every person living with HIV needs to become more responsible to, first of all, improve care, quality of care for themselves with the support of families. For me, I believe so much that the family has a lot to do in the successful care of a patient of a person living with HIV, because the stigma might begin from the family level and then community, sometimes workplace. So I call upon families and communities really to develop a positive attitude towards those who are living with HIV, and so that they get encouraged and they know they are appreciated, and then they can make positive contribution and desist from the idea that I am not going to die alone. Because when they are frustrated, some of them, especially young people, say, I got it from someone and I'm going to transmit it, which is not a good thing.
So maybe one question, since
yes.
you are publicly
I'm a teacher by background, and I got my HIV results when I was teaching in Mbara Secondary School. And Mbara Secondary School is one of the biggest schools here in Arua. And when I first got my diagnosis, I didn't get counseling. So in the beginning, I also had my spouse, my husband was sick and had emaciated so much. You can see that is somebody with HIV. So I was already being looked at with the stigma. Even my fellow teachers would not feel comfortable sitting with me under the tank. We have a place which we call it's a tank, the school tank, and that's where we sit, and it's like our resting place. So when I sit there, teachers don't feel free. When I go to teach in the class, some students don't want me even to move there. So what I did, I went to the headmaster. I told him, head teacher, I don't want to teach this class. I don't want to teach this class. Give me classes where I'm comfortable. And he accepted. And that was a big edge. So accepting my HIV status benefited me a lot, because even when I went to the hospital, the doctor, the medical superintendent at that time said, now you people, let me first attend to Rose, because she has underlying problems. So I would be given privilege, opportunity to get best care. So if you hide, you block your opportunities. But when you're open, you get a lot of support. So being open to me is privacy was attacked. Okay. So my thinking is change is inevitable, and when you don't change, change will change you. And now change was changing those people, and their adaptation was negative. Some of them are saying they're not going to come for treatment. If it means going to OPD, let the treatment stay. But my advice is that let us take this positively and let counseling go on, so that people who are still in denial can appreciate that nobody really wants to get this infection, but you find yourself in it. But when you are in it and you respond positively, it cannot kill you. So that means they need to be given counseling support so that they look at positive ways of responding. And that is what it means in the theme. The theme says transform the approaches of addressing the response to the HIV problem. So that is why I'm saying that these new changes have come, and it is inevitable, and it is global. America didn't cut money only for Uganda. America cut money for lots of people, but we have to cope. It's in the same way in the family. If you have done your garden, you planted your crops, and that year they didn't do well, still you have to find a way of making sure food is there on the plate. So my peers, the people living with HIV, need to appreciate that you cannot continue to hide. It's better even to fight in the open. So that's what I really wanted to bring out, and as peers we need to really remain a little bit close together to be able to support each other, so that we get peer support. That is a very important thing. Actually, when I was talking there, probably I didn't talk about it very much. Especially the ladies, the young ladies with HIV, even when they go into a marital relationship, the in-laws also are attacking them. They are telling me it's unfortunate. But when a woman takes her drugs faithfully, the HIV drugs are supposed to lower your viral load to an extent that it is not detectable. Like us, now when they check my viral load, they'll find it is not detectable because I'm trying my best to take my medication. So even people who are expecting children, by the time they think of getting a baby, conceiving, they need to be close with the medical people. Both the partners need to have their viral load suppressed. If both of their viral loads are suppressed, there's a great chance that the children will be HIV negative. And when their viral load is suppressed and the child is conceived, the mother is also put on prophylaxis, which protects the child right from the time it is in the womb. So science has done a lot to be able to control the HIV situation. But human beings, we are careless. We are not making use of the services to the best of the capacities that we are supposed to. If we only were taking great care and following instructions, we by 2030 should be able to control the fathers. The skit which was played here, you saw. We parents were not doing well. We are not helping our children even to be able to resist temptation in the community. Okay, the mother was not very friendly, the father is not friendly, and so the girl decided to go for what? For a dance. In the dance, she ended up in the wrong place, and at the end of it all, she got all those infections. So the whole community needs to be aware that the northern region, we are doing very, very badly in terms of high school dropout rate among girls and high rate of teenage pregnancies. Children mothers are giving birth to babies, they cannot even look after them. So it is really very, very challenging, and it cannot be a one sector thing. We can not only point fingers at the young people. It originates from the parenting. Parenting is very poor. Survival is so hard. The mothers are the whole day, if they, let's say the ones here in Arua city, they are looking for survival, selling here and there. They have no time for the children. So the blame game cannot gain us much. We need all to accept the situation is bad. What can I do better as a parent? What can I do better as school administrator? What can I do better as a community leader? If we see there are two people going and it seems to be having a funny relationship, in the olden days, community is responsible for the welfare of the young people. But these days, everybody for himself, God for us all. I cannot have the courage to talk to another person's daughter to advise that, what you're doing is not correct. She can even shout back at me, who are you to tell me? So we have lost the safety net of the community, and that is one of the reasons why everything seems to be going bizarre. And survival is so hard. That girl in the play went to go with the mafuta mingi because the parents are not giving her needs. So those are some of the issues.
Thank you.